שימו לב לרכב של ניסים, של הבן של ניסים. מחורר מיריות. לא יודע איך הוא יצא מזה בנס. כל הרכב זכוכיות.
כן, זה מה שפגע בו.
מלא דם.
שי, זה הכדור שפגע בו.
איפה?
זה הכדור שפגע בו.
הזוי.
הגעתי לאיזושהי מסקנה שכנראה אני לא אשרוד.
Shalom. I'm Dr. Shiri Ben-David, the chief psychologist of Hadassah Medical Organization's 2 hospitals in Jerusalem. We have 130 psychologists on our staff. We work in 40 different departments and clinics in the hospital, of course in the psychiatry departments, but also in departments like obstetrics, oncology, rehabilitation, and child intensive care. As you can imagine, since October 7th, 2023, we have faced additional challenges. Many severely wounded soldiers and civilians arrived at Hadassah's hospitals starting on October 7th. Patients received psychological care in addition to physical care. Many patients arrived with acute stress and trauma, even if they didn't have physical wounds. A young man, for example, felt so guilty that he had escaped the music festival massacre that he couldn't get on with his life. Let's hear from one of our wounded patients now. Timur Cohen-Sasson is a police officer who was among the first to fight the Hamas terrorists.
קמתי, התארגנתי מהר, תוך כדי הזעקות אני ממשיך, מצחצח שיניים, שוטף פנים, מסדר את עצמי, מתלבש על מדים, לוקח את הנשק, לוקח את התיק ובא לרדת. ומולי עומדים משהו כמו 150 מטר ממני, עומדים קבוצה של 7 או 8 אנשים, לבושי מדי צה"ל, מחזיקים ביד שלהם קלצ'ניקובים. הצורת תפיסה שלהם, הצורת הליכה של אותם מחבלים, הבנתי שזה לא חייל, זה לא שוטר, זה לא כוחות ביטחון. פשוט פעלתי מתוך אינסטינקט, מתוך איזשהו מוד אוטומטי כזה שחייב לעשות משהו. הגעתי לאיזושהי מסקנה שכנראה אני לא אשרוד. אבל לא עלתה בי מחשבה אחת כאילו לברוח, או כי ידעתי שאני צריך להילחם.
היה מול 8 מחבלים שהם היו עם נשק, הוא היה רק עם אקדח. זה מלחיץ.
את לא יכולה לעזור לו, את לא יודעת בכלל מה קורה, את שומעת את זה רק בדיעבד. ורק כשהוא התקשר ואמר ממש כמה מילים. נפגעתי, היה לי תקלות עם מחבלים והכל בסדר, אני באמבולנס, ואני לא יכול לדבר יותר, זהו, כאילו פה הוא עוד יותר השאיר אותנו בלחץ ובמתח.
והגעתי ב-6 בבוקר לירושלים, להר הצופים. נכנסתי לניתוח, אני זוכר שחתמתי על המסמכים, כאילו כל הזה. ושאלו אותי עם מי אתה, ואמרתי להם שאני לבד. וההורים נעולים בבית, בממ"ד. אין לך את האפשרות לקום מהמיטה לבד. אין לך אפשרות לשתות לבד, לאכול לבד.
הוא היה שבור, הוא היה מרוסק, הוא היה כואב, הוא היה עצוב. הרבה חברים שלו נהרגו. וכשהגענו אליו, אז הוא הרשה לעצמו להתפרק. ואז זו פעם ראשונה שהוא בכה והוציא את זה.
הרגע קשה, כי תימור הוא בעיקרון חזק, הוא אחד שאין לו, הוא לא מפחד מכלום.
I started to speaking with the therapist, and I see how much I needed to release all what I feeling, and yeah, it's helped me. I know after 8 months I was in Hadassah, that if I didn't speak with the therapist, I was crazy. I lose it. And today I really thankful about it. Today I work 2 or 3 days in week. My job is an investigator, a detective. It's a process. You need to be with the process to success in the treatment.
Dr. Ruth Elimelech has accompanied Timor throughout the year. She is in charge of treating the war-injured in Hadassah's new Gandel Rehabilitation Center at Hadassah Hospital, Mount Scopus.
On October 7, the traumatic events were very intensive, very hard, more than even the usual trauma that we know, that we are used to. We want to prevent psychological disorders in the future. The psychological aspects are part of the process, and it affects also the physical recovery. We want to build together with them a better future of full and meaningful life. One of the main issues that we deal with in the sessions is guilty feelings that they are here in the hospital while their friends are continuing fighting, grief and sorrow, feeling sad about losing their friends, losing some of their abilities, losing sometimes limbs. And we have also the common issues in rehab process, dealing with pain, dealing with disabilities, self-image, body image. I hear pain and sorrow, but I also meet the resilience and the great spirit of the soldiers, and it gives us strength and also hope.
We psychologists utilize all the tools of psychology, including different sorts of psychotherapy, hypnosis, and eye movement desensitization and reprocessing, EMDR. These methods help us address trauma-related distress, including flashbacks, nightmares, anxiety, and depression. Once, seeking psychological help was embarrassing, even shameful. Today, thankfully, the stigma is gone. Israelis know that not dealing with trauma doesn't make it go away. It can come back as chronic anxiety or post-traumatic stress disorder, PTSD. Michal Eilon is a nurse and mother of 10. She and her husband and 8 of their children were invited to spend Simchat Torah with the new soldiers on the Zikim IDF base near Gaza. On the morning of October 7th, she was shot by a terrorist while treating a wounded woman soldier. A year later, she describes her journey dealing with trauma.
I was afraid I was going to die after the soldier in front of me was shot, and I knew someone there is going around with a weapon and can shoot me. The soldier that I tried taking care of, she was wounded very badly in her head. I was injured very badly. I had 3 bullets that hit me, one here in my stomach, one in my chest, and one in my hand. Especially my hand was wounded very badly. I had a nerve that is torn. All my bone was smashed. The children and the shelter was really, it occupied me. I didn't think they would be hurt physically. I thought of them seeing me for a long time, bleeding and worrying for me. I think here in Hadassah, I felt they understand the rehab process that we're going through, because even though I'm strong and I'm a mother and I have 10 kids and I worked 100% of my time, and it was very frustrating. I could cry from the idea and the fact that I couldn't put my head cover. I think it's magic the way psychologists they help you find yourself and explain yourself to yourself. I think it's one of the most important things about the rehab. And then the psychologist used a therapy method called EMDR. It looked like magic, like I said. It looked weird to me that if she does like this and I look with my eyes for this side and that side, it would help. But it helped. And after we've done it for a couple of times, I still see the sight of that soldier, but it doesn't like make me want to cry or very tensed. I still remember where I am. I'm here in that room. Before, when I saw it, I felt like maybe I'm still there in the base. I can't explain it, really. It was weird to me too, but it helped.
At Hadassah, we provide the compassionate and professional treatment that soldiers and civilians deserve. We need more psychologists, more working space, and more training. The experience of our people since October 7th is unique, but we are learning valuable lessons for humankind and breaking new grounds as we work. We are focusing also on building resilience. One of the most important factors in resilience is social support. We are encouraging those who feel isolated and lonely, with chronic anxiety and stress, to spend more time with family and seek community. Being a part of Hadassah, the Women's Zionist Organization of America, where you can find like-minded friends and unite for the sake of the community in Israel, is an excellent preventative and treatment.